Hi everybody, it's Dr. Magnifico from Vet and Polly.com. This is Ladybug. She's an older lab. She came into us really not feeling well, so she's been depressed. She has been losing some weight and she's an older dog. Based on her preliminary blood work, she had diabetes, so we learned pretty early on that she had diabetes. Most dogs with diabetes get it because it's a lifestyle thing, so I have other videos on that, but most dogs are urinating a lot because they're drinking a lot, and that's the diabetes coming through. You also see weight loss, and some of these dogs are eating more than normal. So she came in the first time really not looking very good at all. She not only had diabetes, but she had diabetic ketoacidosis. So that required that she immediately go on IV fluids as we tried to get her blood sugar down. So the diagnosis for DKA is a blood work, a high blood glucose, and then a urinalysis that has sugar in it and also ketones in it. So we are trying to manage her on a budget. It's not easy to do, especially when they come in that critical. She is now not eating and she's also not drinking. So some of the things that she needs to do at home so we can help get her blood sugar under control are to do sub-Q fluids. Sub-Q fluids are just putting the fluids under the skin. So it's under the skin and the pocket between the skin and the muscle. So we're gonna do this video to help her dad do this at home. So you always use a new needle. I know people get really worried about the needle part, but the needle part is important. It's got to be an 18 gauge. I really think it needs to be an 18 gauge because it's really hard to push the volume of fluid that you need to get under the skin with a small gauge needle. So a bigger needle is more difficult to put in, and it's also more painful, but it's also super critical if you need to get a large volume of fluid in. So the way to do it is thus. You know, take the cap off of the needle, and this is how I hold it. You know, I'm not at the needle. You don't want to contaminate this. This is a brand new needle. That's pretty critically important. You need a new needle every single time. The next thing is that you take the hair. So I just have the hair that I'm pulling up from the skin. So I'm making a little tent with the skin. And then running parallel to the body, I'm not pointing down, I'm just kind of pointing across at the base of that tented skin. So here's the hair, there's the skin, and then there's a little pocket underneath. So that's what I'm aiming for. You don't want to go down into the body, you just want to go under the skin. So I'm going to slowly push it in. Most animals, especially dogs, won't react. And then that's how you know you've got it in. It goes in really pretty easily, and then you can feel it underneath. And then the next thing to do is check to see how much fluid. So we're at 250 right now. I want to at least get 250 in. So you just want to know where your starting level is. Take off the closure, and then you should see it running. You know, it should be dripping here, and you should see it going in, and it's going to make just a big pocket of fluid. You know, the amount of fluid that you give really is determined by how sick the animal is, how much fluid therapy you need to replace. Dogs and cats will feel it go in. It's a little chilly, but you should feel this pocket happening underneath the skin. So as long as this is running well and that's staying in, you just infuse the volume that you want to. So we're going to let this go to about the 4.5 line so that we get that much in. If it's running slowly, you squeeze the bag. That'll have it go faster. And then sometimes you have to pick up the skin a little bit and just manipulate the needle to make sure that it's in a nice big pocket underneath the skin. This is absorbed somewhere between 12 and 24 hours, so it keeps your dog hydrated or pet hydrated for at least that long. Any dog who's vomiting, any dog who's not eating or drinking, any dog who's depressed really will benefit from sub-Q fluids. It's not the same as IV fluids, so IV fluids is intravenous. Sub-Q is subcutaneous. This is a Band-Aid. It's not ever going to be as good as intravenous, but for those, you know, we're coming up on holiday weekend, so this is the best that we can do for Ladybug. So we're going to give her a big volume of fluids, especially because she's not eating and drinking. She vomited yesterday. This will help the fluids that she's lost with that, just in not drinking and in vomiting. You know, I think a good rub to the head always helps, and then we hold on to the needle where it's at. When you go to take the needle out, we're just gonna, you'll stop this off. We're gonna let a little bit more, run in a little bit more. To take the needle out, what we do is you pinch the skin where the needle's out and then just take it out. So you're holding sort of that little hole closed. And hold it for a couple of seconds. It's not uncommon to see a little bit of blood or a little bit of fluid leaking out, but if you just hold it for a minute or two, it will stop. And then some of these dogs need it every 24 hours. Some of the cats, if they're in renal failure, get it every 2 to 3 days. You know, you put the cat back on your needle very carefully, and then we store it like this, and when we use it the next time, we put a new needle on. If you have any questions about this, you can find me anytime at Vet or Polly.com. Wish Ladybug luck.